Hello, I'm Mohammed Zaredi. I'm a medicine and surgery instructor at Shahid Beheshti Medical University in Tehran. Welcome to DrKhoob's channel. We're going to dive into a very hot and important topic for men: the relationship between sexual activity and prostate enlargement. In this video, we're going to examine everything in detail, step by step. From whether these two things are even related at all, to how sexual activity can help prevent benign prostatic enlargement or improve its symptoms. It doesn't matter if you're single or married. In this video, we have something to say to everyone. We're going to explore and discover together exactly how many times a week sexual activity is beneficial for maintaining prostate health, and how to have a pleasurable and hassle-free sex life. So continue watching and stay with DrKhoob until the very end of this video to gain a significant amount of useful and practical information about sexual activity and prostate enlargement. In this video, we're going to answer these questions. What is the connection between sexual activity and prostate enlargement? What does science say about the effect of sexual activity on benign prostatic hyperplasia? How can sexual activity help prevent BPH, or benign prostatic hyperplasia? If you have BPH, can sexual activity improve your symptoms, or does it make them worse? How does being single or married affect sexual activity and prostate enlargement? How many times a week is sexual activity good for prostate health? And how can you have a pleasurable and trouble-free sex life, especially if you have BPH? And finally, I'll tell you what to do if you experience pain or discomfort after sex. Please consider liking this video and subscribing to the channel, because this shows your incredibly valuable and special attention to this content, and helps this video reach a much wider audience of viewers. Before anything else, we need to explain what the prostate is. The prostate is a small gland located just below the bladder in men. This gland plays a key role in producing semen. Now, it's interesting to know that sexual activity and ejaculation can help maintain the health of this important gland. It functions in a manner similar to how sexual activity acts as a natural way to flush out and drain the prostate. Furthermore, there are various physiological mechanisms through which regular sexual activity can help prevent benign prostatic enlargement or significantly improve its associated symptoms. The first effect is the drainage of the prostate. Frequent ejaculation acts as a kind of drainage for the prostate and can prevent the accumulation of harmful substances, toxins, and inflammatory cells that over time could cause inflammation and abnormal growth of the prostate. Imagine the prostate as a small reservoir. If this reservoir is emptied regularly, the likelihood of harmful substances and deposits building up in it decreases. The second point is increased blood flow. Sexual activity increases blood flow in the pelvic area, which can help maintain prostate health. When blood flow to an area significantly increases, more oxygen and nutrients are delivered to that specific area, which can help to gradually improve prostate function and reduce inflammation. The third benefit is the effective reduction of overall stress levels. Stress is one of the main factors in causing inflammation and various diseases. This includes conditions such as benign prostatic hyperplasia, or BPH. Sexual activity can help reduce stress and anxiety by the natural release of happiness hormones like endorphins. Reducing stress can also significantly improve overall prostate health and help prevent prostate enlargement. And the fourth point is the anti-inflammatory properties of the fluids released during ejaculation, which contain anti-inflammatory compounds that can help improve BPH symptoms. These compounds can reduce prostate inflammation and, over time, lead to a reduction in gland size and the disappearance of symptoms such as frequent urination, difficulty urinating, and pelvic pain. But what difference does sexual activity make for married and single people when it comes to benign prostatic enlargement? The answer to this question isn't very simple, because there are various factors that need to be considered. However, there are some general points that can help you. First, let's talk about married people. In general terms, married people, because they tend to engage in more frequent sexual activity, are at a significantly reduced risk of developing BPH. Having regular and stress-free sexual activity can help to effectively support and maintain overall prostate health. Of course, this doesn't necessarily apply to every single person, and some married people may have less sexual activity due to a wide variety of different health issues, such as erectile problems or certain underlying medical diseases. Now, let's move on to singles. Singles generally have less sexual activity, and for this reason, they may be at a higher risk of developing an enlarged prostate. However, this does not necessarily imply that all singles will develop BPH, or that it can't be effectively prevented through proactive measures. Having regular and stress-free sexual activity, even for single individuals, can significantly contribute to maintaining overall prostate health. But how many times a week is sexual activity good for prostate health? The answer to this question isn't a specific number and depends on various factors. For example, age. As you get older, you may need more sexual activity to maintain prostate health. Health. If you have underlying medical conditions, you might need less sexual activity. Regarding your physical activity level, if you are an exceptionally active individual, you might potentially require a higher frequency of sexual activity to maintain your prostate and optimal health. And BPH symptoms. If you have clinical symptoms and signs of benign prostatic hyperplasia, you may benefit from engaging in more sexual activity to effectively alleviate and manage your symptoms. Many of you have asked me in the comments, since most of our videos are about the prostate. You asked about the relationship between overall sexual health, and I hope by now your specific question has been fully answered. But in general, we can say that having sex regularly, 2 to 4 times a week, can be beneficial for the majority of adult men. This frequency can help prevent BPH, improve BPH symptoms, and generally support prostate health. Of course, it's important to listen to your body. I always say, don't force yourself to have sex. If you feel pain, discomfort, or fatigue after sex, or if your symptoms get worse, it's better to take a break for now and start more cautiously next time. How can you have a pleasurable and trouble-free sex life, especially if you have benign prostatic hyperplasia? Having a pleasurable and trouble-free sex life is important for all men, whether they have BPH or not. However, if you have BPH, you might experience some specific challenges. What specific kind of challenges might you encounter? It's best to carefully follow these helpful tips and strategies I'm about to share so you can go through this process more easily. First, openly communicate and talk with your partner. The first step is to talk to your partner about BPH and the various challenges you're facing with it. It is essential to remain deeply empathetic and patient throughout this journey. Benign prostatic hyperplasia can be a challenging experience for both of you. You might both feel upset and stressed, so try to find solutions together. Take some time to talk together openly about various ways to have a pleasurable and hassle-free sexual relationship. Consider using a high-quality lubricant gel, a gel that can significantly reduce friction and make sex much easier and more enjoyable. Experiment with various different sexual positions. Some positions might be more comfortable for you given your specific condition, and you'll need to figure out which ones work best for you. Finally, carefully review all of your current medications with your doctor. Some blood pressure medications can cause erectile dysfunction or decrease sexual desire. However, you can also use sexual stimulants like sildenafil or other similar drugs, but make sure to do so under a doctor's supervision because some of them can be dangerous and may cause serious side effects. Use relaxation techniques as well. Stress can worsen blood pressure symptoms, and having a calm, stress-free sexual relationship can be very helpful. If you experience pain or discomfort after sexual activity, talk to your doctor. The first step is to tell your doctor about any pain or discomfort you experience during sexual activity, because you might need to have your medications adjusted. Your doctor may need to carefully adjust and monitor the dosage of your blood pressure medications, and additional diagnostic tests might be necessary. Your doctor may recommend and schedule additional tests to thoroughly investigate and identify possible causes of your physical pain or general discomfort. But ultimately, having benign prostatic hyperplasia does not mean you have to completely sacrifice or give up enjoying a fulfilling sex life. By talking openly with your partner, finding creative solutions, and using some of the straightforward and effective strategies I mentioned, you can have a pleasurable and completely stress-free sex life. Don't forget to share any specific questions or concerns you might have in the comments below so I can answer them thoroughly in the next video. If you have an urgent question, since there are a lot of messages here, please ask your urgent questions in the direct messages on DrKhoob's Instagram. I've put the link in the channel description. Until the next video, goodbye.